if you look into the coronary artery disease in India, there is a high prevalence of heart attack in our country. We have 4 times higher chances of having heart attack as compared to Americans, 6 times higher as compared to Chinese, and 20 times higher than Japanese. It occurs in younger age. 25% of heart attack occurs at age less than 40 years, and it is associated with higher mortality, and as is evident that 50% of death due to coronary artery disease in coronary artery disease patient occurs in age less than 50 years. And this is despite we are following Americans and European guidelines. The CVD mortality in India has increased by 41% from 1990 to 2015. And whereas the CVD mortality in USA and European country has come down by more than 50%, and this is based upon 2010 data. So, and one of the reasons for this decrease in mortality in USA and Europe is due to their guidelines. That has increased awareness about association of cholesterol, high levels of cholesterol with the heart disease. And it is said that approximately 12% of this decrease is because of reduction in the level of cholesterol. What are the reasons why we have high incidence of heart attack or cardiovascular disease? Is because there is some genetic influence. We have a different type of lipid profile which we call as atherogenic dyslipidemia, in which we have high level of triglyceride, low level of HDL cholesterol, and LDL cholesterol is either normal or mildly raised. And the second problem is central adiposity. We are obese. If you look into the obesity, it is more of a truncal obesity, and there are deposits of fat in the visceral tissues in abdomen, around the liver, around the heart. That leads to that is one of the reasons behind increased incidence of cardiovascular disease in our country. And of course, dietary factor also plays very important role, because we consume lot of carbohydrate and fat, and we love sedentary lifestyle. We do not exercise. We are not aware about association of exercise and diet with the coronary artery disease. And of course, we are scared taking medicine, whether it is for hypertension or for diabetes, whatever the reasons may be, because we always feel comfortable by not taking medicine, and if taking medicine we think it is a curse, which of course is not right. Now, looking into all these aspects, Lipid Association of India, which was founded in 2012, we came out with a statement with basic objective of reducing this cardiovascular morbidity and mortality in India. In recommendation we came in 2016. It was published in Indian Journal, where we recommended the LDL cholesterol target, which were lower than Americans and European, and it was less than 50 milligram, whereas European guidelines or American guidelines suggested LDL cholesterol target of 70 milligram. There was strong evidence for us for this lower LDL cholesterol, and subsequently even European guidelines 3 years later also brought down the target to less than 55 milligram. So then we subsequently found that 50 milligram may not be the ideal goal for all patients of heart attack. There are patients of heart attack who are associated with other medical conditions like diabetes, hypertension. Many of our patients, they are smoker, they take chew tobacco, and they have other problems. So there are some group of patients who will require lower level of LDL cholesterol of less than 30 milligram, and So, we published this statement about these group of patients in 2020. So, today my talk in this conference was to just highlight that we should have a different level of LDL cholesterol in Indian population with patients with heart disease, and there are we do expect benefit to come in years from now, because it will take the time to spread this message across all the doctors, and this type of conference is a good platform for us to interact with the healthcare professional. And I'm hopeful that the doctors, the audience who are there, the delegates who are there, they have understood. We had a good interactive session, and it will definitely help them to have to incorporate these targets in their medical practice, and that will benefit the patient whom they are treating. Thank you.